Hi, I'm Isaac Caldwell, and the case study that I chose is the Jehovah Witness with severe anemia. I chose this case study first because I'm interested in medical cases, and because I'm curious to how medical professionals deal with such an ethical case such as this one. For some background, the patient is an 18-year-old female with sickle cell disease and anemia. Sickle cell disease affects the shape of the red blood cells and makes it difficult to transport oxygen around the body, and anemia is a low number of red blood cells. Medical professionals normally treat patients with extreme anemia with transfusions of blood. However, Jehovah Witnesses refuse to receive any transfusion of blood or blood products because of their religious beliefs. Any Jehovah Witness that accepts a blood transfusion are no longer to be allowed to associate with the religion or its members. This particular case is ethically tricky because throughout TH's childhood, her anemia was treated with blood transfusions. When patients are still considered minors, medical professionals can go against what the parents' wishes are and obtain a court order to provide the life-saving medical treatment that the child needs. Now that TH is legally adult, she is able to decide if she will honor her religious values or live. She ultimately chooses not to receive the transfusion. So, the obvious main problem in this case study is that TH needs a blood transfusion but will not get one because of her religious beliefs. The first step for medical professionals is to ensure that TH is making this decision independently and not making this decision because of the pressure from her parents or the rest of the Jehovah Witness community. The article even mentions that doctors will privately offer transfusions to TH without letting her family or other community members know. The next step is making sure that TH knows all the risk associated with the refusal of the treatment because she still refuses. The first solution to this problem is for medical professionals to attempt to prevent any other potential causes of further progression of her anemia. So possibly prescribing her birth control to stop her menstrual cycle to reduce amount of iron that she's losing. Another solution provided by medical professionals is attempting to enhance her oxygen transportation ability by offering her non-blood and erythropoietin analog to increase her red blood cells count and ultimately oxygen carrying capacity. So this solution includes giving TH all the possible therapies that could help her condition without resulting in a transfusion. Eventually, with the treatment and of many medications, TH was released from the hospital with normal hemoglobin levels. Not receiving the blood transfusion was not life-ending for her this time, but she could certainly end up back in the hospital again to be treated for her condition. If I was the physician assigned to this case, I would have done the same exact thing in this situation. I believe the medical professionals that were involved on this case ethically made the right choice and ended up saving a life.